Hi guys, it's Dr. Hardy, your pediatric obesity expert, family obesity expert, pediatrician. Thank you for tuning in today. I just wanted to talk about medications in kids. So I've had many parents ask me, can't we give them a pill or something to help with appetite suppression or weight loss? And there are some medications or drugs that have been used in the pediatric population. And one you may have heard of is called metformin. Metformin is normally used for type 2 diabetics, usually in adults. So you may see grandma with a bottle of metformin in the house, but it has been used off-label in kids for weight loss, and it has been used on-label for some children with type 2 diabetes as well. Sometimes you will see this medication used for polycystic ovarian syndrome too. So I definitely have put a handful of children on metformin for concerns about type 2 diabetes, and at the same time it contributed to some weight loss, but that medication is not without side effects. So it gives a lot of GI upset, gassy, loose stools. It can cause something called like a lactic acid buildup, but usually your doctor will be monitoring for that. So it doesn't come without its side effects. Then there's another medication called orlistat. So orlistat prevents the breakdown of fat and also prevents its absorption into the body. So you're basically just excreting the fat. You may see some oily urine and poop. So both of these medications are approved in children greater than 10 years of age. So metformin for type 2 diabetes and orlistat for weight loss. However, like I said, metformin may be used off-label for weight loss as well. So as a pediatrician, I can definitely say that we tend to use medications off-label. For example, Pulmicort is an inhaled steroid that we use off-label all the time for infants who are wheezing, and it may not be indicated for that particular child's age. But in an emergency situation, we know that's all we have, and so we'll still use it. So I feel like as long as your physician is supervising, it is totally okay to use metformin off-label in this situation, especially if your child has many comorbidities, meaning complications due to being overweight or having obesity. So if you have an 11-year-old who already has fatty liver, who already has high blood pressure, high cholesterol, sleep apnea, when you weigh the risks and the benefits, like metformin off-label that can help all these other problems or deal with all these other problems that will lead to heart issues and maybe heart failure and maybe early death. So what do we have? So metformin may be used off-label. I believe orlistat is FDA approved for kids for weight loss, and metformin is the one that isn't. And the guidelines may have been updated, so if I find anything that is updated, I will record another video with the updates on those medications. And I believe phentermine can be used at 16 years of age or older. And I will also make sure there have been no new recommendations of these medications in kids. But of course, I always recommend diet and exercise for at least 6 to 12 months before considering, medications or surgery. It depends on the comorbidities. It depends on how sick the kid is. It depends on how worried I am that if this doesn't get better and the family situation is probably not going to help in any way, I will go ahead and treat sooner sometimes. So it's always on a case-by-case basis. So once again, thank you for tuning in, and I will see you in the next video.